Mm-hmm. And it's the whole point of the practice. I've had a lot of patients tell me, I don't feel like I'm at the gynecologist. I feel like I'm at the spa, which is nice, So I'm happy. I'm happy with how things are turning out.
So if you were just joining us now, I'm Hannah, and this is Dr. Ojo-Carons, who has just this week opened up EvoScient Gynecology, which is a beautiful space in Virginia Beach. And we've been talking for quite some time about your dreams for this practice. And I remember way back you were planning on making it not feel just like a trip to the gynecologist, making it feel a little special, because oftentimes it feels like the care is gone from healthcare. And it sounds like from the 3 days you've been in practice, the people who've walked in the door have had a different experience.
Yeah, I think so. I think they've had a welcoming experience, definitely, and a peaceful one. Because who wants to go to the gynecologist, really? I don't even like going to the gynecologist, and I am one. So there you go. But
go ahead.
I think for what I've experienced this week, I've had each patient tell me that they've actually enjoyed their visit. So that's a good thing.
Well, we're here to also just break down. I'm just going to ask a silly question, which is just, can you explain, you deliver babies, but this practice is specifically gynecology. So just the GYN portion with a specialty in pelvic floor dysfunction. Can you break that down for us a little bit?
So the specialty of OBGYN is actually a combined specialty. For years, you had individuals that practiced obstetrics, which is OB, and you had individuals who practiced gynecology, which is GYN. And so a number of years ago, the practice combined to make one field of practice because both deal with women. And so gynecologists deal with the female reproductive system, basically. They deal in the science of women. There is some overlap because women get pregnant, obviously. So, but they do not take care of women generally while they're pregnant. It's outside of pregnancy. So the main focus of a gynecologist is to keep a woman's reproductive system healthy. But often you see gynecologists not just work in the specialty of gynecology, but also work as the primary care physician of patients. And I think it's because, in my opinion, the visits are so intimate because you are exposed, you're very vulnerable during that visit. And so there is a very special relationship that is created between a gynecologist and their patients. And so many women then feel more comfortable explaining other parts of their healthcare and to their gynecologist compared to maybe just, not just, but maybe a general practitioner, internal medicine physician, family medicine physician.
And you said something really compelling to me when we were first talking about the pelvic floor, which is just that there isn't really standard of care for recovery for women. I remember when I had my first kid just being so surprised that essentially I'd undergone, I'd been up for however long, I'd squeezed the baby out. It had been a traumatic delivery. And then there was then they were like, here's a baby. If you go through any other surgery, they're probably going to say, rest, don't lift anything, sleep. And in this case, it's just such a different circumstance. You're kind of off to the races the moment you have the baby and there's no standard of care. And even if you don't deliver, you can still have pelvic floor issues because that is the thing supporting all of us. Is that
exactly? And we call it your girdle for a reason. It really is your main support. And so you're definitely right. You don't have to have had a pregnancy. Well, let me start first. You don't have to have had a vaginal delivery to have pelvic floor dysfunction or problems. you don't necessarily have to have had a pregnancy. You don't even have to be a woman really to have a pelvic floor disorder, because men have a pelvic floor too. And so really the pelvic floor is combined of muscles and fibers that support the pelvis. And so it is your main support system. You wouldn't be able to stand without a stable pelvic floor. You wouldn't be able to walk properly without a stable pelvic floor. And so dysfunction can occur for many reasons, but for women, it oftentimes occurs, one, because of just being pregnant. That weight, that pressure of the pregnancy, even if you don't deliver vaginally, does weaken the pelvic floor. And then two, with menopause, because of the loss of estrogen. And so, yeah, many people do suffer from a level of pelvic floor dysfunction, but oftentimes we kind of make that dysfunction seem functional, or we function with it and just make it a part of our everyday. So symptoms of pelvic floor dysfunction include pelvic pain, pelvic pressure, pain with sex, pain with sitting, urinary incontinence, fecal incontinence. It runs the gambit. And so there are many different ways to address it. But the best way to address it is first to know that you have a problem, so that you can address it.
Yes, so many of the things you just mentioned sound like things that have, in my brain, been normalized as how it feels to be a woman. So it feels kind of crazy to think that that's something that wouldn't have to be lived with.
Yeah, and going back to how the fields overlap and how they are, essentially can oftentimes are considered to be the same with obstetrics and gynecology. We do, as obstetricians and those who deliver, like you mentioned earlier, I still deliver, just not in this practice. But we still do recommend women not lifting anything heavier than the baby until you're seen at your postpartum visit. Try to rest, try to hydrate, so on and so forth. But we don't necessarily give women the tools, in my opinion, to do that. Because again, here's the baby, there you go, and so you're going to be up. You're going to be not necessarily guarding your pelvis like you should. You're going to be not necessarily lifting, like you should, no matter what anyone says. I don't know who's 1 to 2 weeks out and not lifting up a car seat.
Car seat, yeah.
Yeah.
I was just thinking car seat plus the baby alone. I mean,
Yeah.
nobody's asking you what's your support system.
Yeah,
like?
yeah. How are you going to get it in the stroller if you don't lift it out of the car?
Right.
So, so I think it's really important as practitioners to address it, as for obstetricians to address it during pregnancy, for gynecologists to address it, and also for just women to be aware that it is not necessarily normal to live in pain. It's not necessarily normal to live with discomfort. Certainly, discomfort and pain may not be able to be completely taken away with any modality of treatment, but it can be managed, it can be treated, and it should be addressed.
So I'm going to be the guinea pig here and be a little vulnerable. I sometimes, just some days, will have a lot of pelvic pain, and other days, fine, don't notice anything. So would I be a candidate to come in? How should people know that they should come and have an evaluation?
Well, yeah, you definitely would be a candidate to come in for an evaluation. Our bodies and our brains work as one. And so even though you may have an issue, you may have a muscle that's overworked anywhere in your body. Imagine just your neck muscles, your back muscles. Some days they feel worse than others. Some days, if you've been out in the yard doing yard work and they are sore, you come in, they're sore, you go to sleep. The next day they don't feel as bad. You have still overworked that muscle. And so the next time you try to do something, you attempt to do something, it'll be that much easier to have pain in your back until it's actually addressed. Certainly intermittent pelvic pain that comes and goes, you're a candidate to come for an evaluation. There are many other reasons for pelvic pain, and I certainly don't want to minimize any other gynecological reason for pelvic pain, whether it be an organ issue or um, anything worse, but still, it should be addressed.
Well, I just want to come to spend time with you.
Yeah.
I did want to say, you've just opened up EvoScient Gynecology this week. You have done 3 days in this brand new practice, this new venture for you, for which you've had to spend a lot of time doing things that were not just treating pelvic pain and being a gynecologist, which is enough for most people just to do that one job. You did a full remodel of the space. It's beautiful and fresh and inviting. You have been up late nights dealing with all different aspects of starting a business, let alone a gynecological practice. And Ronette's here tuning in, and she gives you for that too. And so I just wanted to ask, why are you so crazy? Why'd you do that?
I like challenges. I do have a lot on my plate. I have 2 small kids. My husband's also a physician, a surgeon, and in a very busy practice. So we burn it on both ends, but I wasn't happy with how I was giving care, and the way I was practicing before I opened EvoScient. I wasn't happy in how I felt that I wasn't really able to address my patients' problems. And also, because of certain constraints, I didn't feel that I was able to really help them understand how special they are. One of the main points of EvoScient is to encourage women, female empowerment. Again, it's a vulnerable time to come to the gynecologist, but it should be a time where we are empowered, because you as a woman, you're taking care of yourself. You're taking that step to make sure that you're okay, that you're healthy. And so I want the entire visit to be focused on that, focused on empowering, focused on encouraging, focusing on letting each individual know that they are special, and that they are valued, that they have value. And so if I could just bring a little bit of light into every person that walks into that building, and just a little bit of light goes back out into the world, then we have a lot of light in the world. And so that is one of the main focuses. And I think I think in these last 3 days, we've imparted that to our patients that we've had, and I hope that we're able to continue.
Well, I've been in the space and I've been around you and I've felt all that. I haven't felt it with a speculum. So we'll see if it holds up with that. But so people can schedule appointments now and come in and see for themselves.
Yeah.
Ronette's here. I just want to read her comment. She says, "You put God first and everything else second, and he literally opened doors. I'm so proud of you and beyond happy for you. Congrats again, my dear."
Oh, thank you. Thank
so a lot
you
of
so
people
much.
are very excited because you're bringing so much value to the community, and so many women, so many people in general, but I think specifically I want to address women. It's just really important to have some place you can go that feels like care.
Yeah.
So we want to do this as a recurring thing. We want to come live here on Wednesday nights and talk about lots of different topics. There's so many juicy questions that we have, and we want to know what questions you listeners have. So if you have a question, we'd love for you to hit us up. We're on LinkedIn, Twitter, Facebook, and Instagram. So you can send us a private message if you want to, or you can add a comment under our videos with questions, and we will try and address them in future lives. But we're going to try and do it Wednesday nights at 8. And if we change it, we'll definitely let you know.
No question is off the table. Well, maybe some.
Well,
we'll come back to that.
I saw a post recently about best positions for sex in the shower. I think that also just depends on the geometry of you and your partner as well.
In the shower.
Yeah. In the shower.